those with a cold or sinus infection can be difficult to deal with. They can also be distracting, making being a breastfeeding mom that much more difficult. You feel miserable, but you also have a baby to take care of. You might be looking for something like Dayquil that can help make you feel better throughout the day. But this is where it can get tricky. Some drugs, including over-the-counter medications, can make it more difficult for you to breastfeed, either by hurting the milk supply or by passing it to your baby through your breast milk. This means you need to avoid such medications and choose the ones that best suit your needs and those of your baby. Before you reach for over-the-counter medication, it's important to get the facts. It's recommended that you talk to someone at a healthcare provider or pharmacist, so that you can make an informed decision about taking over-the-counter medication such as Dayquil. Sally Radford is an expert in the field of chemistry, and she'll be walking you through how Dayquil might affect your milk supply, and whether or not to take it. Now, what are NyQuil and Dayquil? Dayquil is made up of 3 ingredients: acetaminophen, a pain reliever and fever reducer, dextromethorphan, a cough suppressant, and phenylephrine, a decongestant. Like Dayquil, NyQuil also contains paracetamol and dextromethorphan. But instead of phenylephrine, this variant contains doxylamine, an antihistamine and sleep aid. The key differences between Dayquil and NyQuil are that Dayquil does not contain ingredients associated with sleep, and only the daytime version aka NyQuil of the product contains ingredients known to help with cold and flu symptoms. But, is it safe to take Dayquil or NyQuil while breastfeeding? Breastfeeding can be challenging, but it's important to take care of yourself and your baby. Dayquil and NyQuil are great for relieving minor symptoms like a headache or coughing. If you're breastfeeding, however, these medications can harm your milk supply. Dayquil, a famous over-the-counter and pharmacist-recommended product, contains a decongestant. Despite what many people believe, this medication is not compatible with breastfeeding. Oral decongestants may decrease breast milk supply by interfering with the release of oxytocin during breastfeeding, says Dr. Carbone. While NyQuil does not have a decongestant, one of its ingredients is an antihistamine. Antihistamines can also affect milk supply, especially when used for more than a few days. The antihistamine in NyQuil may cause other problems such as irritability or drowsiness in breastfeeding infants. It's normal for breastfeeding journeys to be different. You should consult with a healthcare provider if you have any concerns about taking Dayquil or NyQuil while breastfeeding. What if I'm already taking either? When can I resume taking Dayquil or NyQuil? Both Dayquil and NyQuil have the potential to reduce milk supply, so it is best to wait until your infant no longer needs them. Although NyQuil has a lesser chance of reducing milk supply, it too can be potentially addictive and cause drowsiness or irritability. Here's a list of safe alternative treatments: honey, Tylenol, hot water, or tea. Was this video helpful? Kindly like, share, and subscribe to our channel.